Hi friends, I'm Karuna and I welcome you to our very essential show Patients Education series on cancer. Today, cancer continues to be one of the deadliest diseases globally. In India alone, around 4,50,000 patients die due to cancer. Annually, there is an increase in the number of fresh cases which accounts for roughly 7 to 8 lakhs. This ever-increasing number in unwanted cancer patients is a cause of concern for the medical fraternity. Today, we will discuss breast cancer in depth and we will be joined by Dr. Nitesh Rohatgi, who is a consultant medical oncologist at Max Super Speciality Hospital. He is an authority on the subject. And let's welcome him. Hello, doctor. Welcome to the show.
Hello, thank you for having me there.
Doctor, please help us understand breast cancer.
So, cancer is any abnormal group of cells that grow unguarded because either these cells have developed abnormality which makes them grow many volumes more, or because the second system in a body which normally checks that has stopped working. Breast cancer is when that process happens in the breast, which can develop either more commonly in the ducts of the breast which supply milk, or in the tissue that or the glands that make that milk, which is called lobular cancer.
Please tell us what are the signs and symptoms of breast cancer.
When we talk about the signs and symptoms of breast cancer, it will not be overemphasis to say that these can be variable, but the most common sign and symptom of at least an early breast cancer is a new lump. I'm not saying a lump, I'm saying a new lump that has developed in either of your breasts. This lump is often painless, it feels a bit like a rubbery ball, and if especially you feel that it's growing every few days, every few weeks, it is something which needs urgent attention.
Doc, is breast cancer treatable and what are the treatment options available?
The question often asked about if breast cancer is treatable has changed drastically over the last decade. From a point where the sheer mention of cancer used to shake our very roots, even as oncologists, we now cure more breast cancer patients than we don't. So, on an average, the cure rates of breast cancer have gone up. The breast cancer is treatable, but the question is, how much does it take to treat the breast cancer? For some, very, very early stages, all it takes is a surgery, and even not a complete surgery, even not a complete removal of the breast, which is called mastectomy, just a partial removal of the breast called lumpectomy may get rid of the entire cancer, sometimes followed by radiotherapy, in fact almost always followed by radiotherapy. However, the treatment required for a more advanced breast cancer is more than one modality. You will need surgery, chemotherapy before or after, radiation often after. You may need hormonal manipulation or estrogen manipulation in cancers that are driven by estrogen, which is a normal women hormone, and these are not all of them, but most of them. And in further subgroup, you find that there are extra aggression factors, receptors called HER2 receptors, which if found need a prolonged course of biologicals or protein based therapy, which helps to increase the chance of cure of these women. In a sense, when you ask, is breast cancer treatable? The answer is yes, or overwhelming yes, but the question and the bigger question is, what all will it take to try and achieve that cure?
Doctor, are there side effects associated with chemotherapy or radiology, and can they be managed?
It's needless to say that more the treatment, more the side effects. I think we've all experienced that a course of antibiotics over 7 days can cause people to have a bad taste in the mouth, have diarrhea and upset tummy. So, it is impossible for me to claim that chemotherapy, radiation or even surgery or the hormonal blocks, which are benign small tablets to be taken over 5 years, will not cause any symptom. However, what we need to understand is that the symptoms, for example, of chemotherapy, such as vomiting, where we have data to say that 7 to 8 out of 10 women used to feel pukish or vomitish till 10-15 years ago, it's now only 2 to 3 out of 10. So, we have come a long way in the last decade, not a little bit. We have made huge leaps and bounds in the additional and supportive medicines, both before and after chemotherapy, to help those very symptoms become manageable. I am not saying negligible, I am saying manageable. And when I give a patient chemotherapy or radiation therapy, our question is the patient having manageable side effects, because the drawback of not treatment is far more than the most reversible side effects we are talking about or get scared about. There are some long-term side effects, such as effects on the heart, the kidney, the liver. Fortunately, these are few and far in between, and when you get treatment at good centers, where the monitoring both during treatment and after treatment is good, you find that patients cope with these symptoms far better, and you also find that patients don't end up in very deleterious or disastrous side effects.
Doctor, what are the risk factors for developing breast cancer?
When we talk about the risk factors of developing breast cancer, there are some which we call more obvious or high risk factors, and interestingly, one of the highest risk factors is age. We do know that breast cancer is a cancer which is more often, almost always seen in elderly patients, typically not before 50 and very rarely after 75. Having said that, since we are talking about age, it is extremely important to realize that we have an increasing incidence of early age breast cancer, and a lot of oncologists and researchers feel, this is just a feel, that in India and the Asian population that might be even higher. So, do not neglect your lump in a younger age. But amongst risk factors besides age, there is a very important role of a family history. Now, we do know that the patients who get breast cancer as a part of their familial risk are much lesser in population than you get without it. So, 10% to 90%. But where there is a strong history of breast and ovarian cancer or ovarian cancer with the mothers, the aunts on the mother's side, the mother's mother, and your sisters, your elder sister or your younger sister, your risk of breast cancer and actually ovarian cancer goes up multifold, more than 10 to 15 times. Now, that is the population which needs very active surveillance. That is the population which needs to speak to a genetic specialist and an oncologist. Besides these two, there are various smaller factors. There is a question if increased weight or obesity can add to breast cancer, increased fat in diet can add to breast cancer, sedentary life and smoking can add to breast cancer, patients who are nulliparous or have not had any children, that adds to risk of breast cancer, and so on and on. So, there is a multitude of factors, and when these factors add on, obviously you can think that the risk of breast cancer has gone up. But do not forget, age and family history are critical.
Doctor, are mammograms helpful in detecting breast cancer? And how frequently should a woman undergo mammography?
When we speak about cancer screening, there are very few cancers which have the evidence, strong evidence, to support screening. Breast cancer is one of them, cervical cancer is another one of them. For breast cancer, a mammogram, typically done at a 2-yearly interval in women between the age of 50 to 75, helps to detect cancers in the early stage. It helps to detect cancers in the early stage, but also decreases the amount of therapy you need to cure those cancers. And there are estimates that up to 20% survival advantage, more than 20 in 100 or 1 in 5 women can be saved, their lives can be saved because all 100 of them have gone through screening. It is an area of debate, but it's a very valid question if screening should start earlier at the age of 40. I think in patients with high risk it should, but it is important to remember that that screening involves a yearly screening, not 2 yearly, and B, many of these women may have dense breasts. So therefore, these women may need an ultrasound mammogram rather than an X-ray or traditional mammogram. Again, it's an area of debate where there is a strong family history, typically BRCA gene mutated. This is a very specific subgroup of breast cancer patients or the families who've got breast and ovarian cancer, if they should have X-ray screening at all, because people claim, researchers have claimed that the mutations in these patients can be driven by the X-rays, which we are actually trying to avoid. So those patients are recommended not only earlier mammograms, but they are recommended MRI mammograms rather than X-ray or ultrasound mammograms.
Doctor, what is a breast self-exam and what does it involve? How often should it be performed?
So, in a lot of patients, rather normal population, it has been advised to have breast self-examination at a regular interval. Breast self-examination, to put it simply, means you examine your breast with the palm of your hands. You go in a very systematic manner, trying from one quadrant to a second quadrant to a third part and the fourth part, dividing your breast into 4 quadrants or 4 parts of the clock. Then you examine the center or the area behind the nipple, and then you go into the armpits to feel if any new lump has developed. However, there is lack of clarity whether it should be done on a monthly interval, a 2 monthly, a 6 monthly, and recently there has been a huge debate if it actually adds to increase survival of patients versus just increasing more surgeries, more X-rays, more mastectomies and so on. We cannot use that data in the Indian setting because it's a Western population, but we cannot neglect that data either because that were good trials. So my take is that maybe on some kind of a regular interval, women could potentially examine their breasts and look for new lumps. However, if at any point you incidentally find a new lump, you should not neglect it.
Is it possible for men to develop breast cancer?
When people talk about breast cancer amongst men, it surprises most people in the world, both men and women. So how can we develop breast cancer? Men don't have breast. But although very rare, it is a known entity, and amongst oncologists, especially breast oncologists, it's a common enough phenomenon. The key thing is if men develop an asymmetrical swelling or lump in one side of the body, so asymmetrical swelling on right or the left breast, then you must get it examined by a female breast oncologist.
Doctor, can women get back to normal life after being diagnosed with breast cancer?
It is not a strange question. This is the biggest and the most important shock that a lady has had in her life so far. The fact and our experience tells us that almost all these women go back to their normal life. They do all the things they do. They look after us as much as they used to do before. And I have often seen they look after us better, they look after themselves better, because I think once a patient develops cancer and survive, they cherish life more. Not only they, the entire family cherishes life more. It is amazing how many cancer survivors are involved with cancer awareness. And I think that number is going to only add on. And in one quick line, my salute to each and every cancer survivor, especially women with breast cancer.
Thank you so much, Doctor. That was an insight to breast cancer.
The pleasure was entirely mine, and thanks to all of you as well.
Today we discussed about breast cancer. In the forthcoming episodes, there will be more on the hidden sides of cancer. So keep watching Patient Education series on cancer. Be alert and live a safe life. क्योंकि हमें आपकी फिक्र है.